N5 South is our unit for our total knee and total joint patients. You will be experiencing state-of-the-art ORs, and those ORs are very specific to our orthopedic programs. So you're not going to just any old OR. You will be in one specific for orthopedics. The teams that work with our orthopedic doctors, those are orthopedic teams. Those nurses and techs, they know how to do a total knee and total hip. So it keeps the room running a very efficient manner. You're going to hear about pain control from one of the nurses on our unit and how to keep that in control, what to do when you are experiencing pain, and some other side effects that may occur with pain management as well.
My name is Nancy Kovac. I'm a bachelor prepared registered nurse, certified in orthopedics at the Reading Hospital, working in the Joint Care Center. Pain management is a big priority for the nurses here that work in the Joint Care Center. We will bring in pain medicine for you that's scheduled by the doctor, and we do have other pain medicine available for you for breakthrough pain. The breakthrough pain medicine, though, you actually have to ask us for. That's not an automatic thing that we will bring in. That pain medicine is available every 4 hours, but you just have to call your nurse and let her know that you need something. The nerve block is medicine that's injected around the nerve in your leg when you're having a total knee replacement. That medicine helps numb the leg so that you don't experience as much pain, which helps with your therapy and with overall coping with the surgery itself. It is possible that you will experience more pain when the nerve block wears off. It's just important to keep on top of your breakthrough pain medication. Make sure you're calling for your nurse, before the pain gets too bad, that we can keep on top of it for you. Icing and elevation is very important. The more you're up and about, the more your leg will swell. So it's very important to rest throughout the day with your leg elevated. Definitely putting ice on periodically throughout the day, but especially after physical therapy. It's either the nurses or our patient care assistants will apply the ice for you. It's individual ice packs that are used specifically just for you, and then you actually get to take those home with you at your discharge. You want to keep on schedule with your pain medicine. Keep in mind that if you're just sitting still, you may not experience pain, but as soon as you get up and start to move or to walk, the pain will increase, especially with physical therapy. So we would recommend that you take your pain medicine before physical therapy, and then after physical therapy, you want to make sure you keep that leg elevated and put ice on it. Before your pain becomes unbearable for you, you want to make sure that you're calling your nurse so that we can bring in the breakthrough pain medicine that is ordered, so that we can keep your pain under control, that it doesn't get to that point where it's unbearable and you're so uncomfortable. Many patients experience constipation following surgery. It's a side effect of the surgery itself, as well as the pain medication. You're not as active as you normally are. So it is important after surgery to get up and get moving, to make sure that you are taking a laxative or a stool softener. It's not a bad idea to have that on hand at home, even before you come into the hospital, so that that's available when you go home, because you're going to continue taking the pain medicine at home. Each shift, your registered nurse will come in and assess you. Part of their assessment is your bowel sounds, which lets us know that your bowel is waking up, and we can tell as far as that you have bowel activity by the sounds that we hear when we listen to your abdomen, and also once you start passing gas, that's a good sign. Don't ever be embarrassed about that, and we would just want to make sure that everything wakes up after the anesthesia. You want to make sure that you eat a little lighter the couple days before your surgery. Avoid the starchy foods, things that'll just sit in your gut, and then following surgery you want to follow a high fiber diet that has plenty of fluids in it, and that'll help ease your constipation. Nausea and vomiting can be a side effect of the pain medication. And you should make sure that you are taking a little bit of something in with the pain medicine when you ask your nurse for the pain medicine. Maybe eat a cracker or a piece of toast or some Jell-O or something like that, and that'll help ward off the nausea or vomiting.
We're very proud of our unit. It's home to us. I hope it's home for you for the next 1 to 2 days.